We are getting new video in from the breaking news we've been following tonight in Oldtown. Take a look. You can see a lot of police activity there. This is right on the line between Oldtown and Orono. Here's what we know right now. According to the town of Orono, officers are helping out Oldtown and state police with some kind of situation. They aren't sharing more details than that. Penobscot County dispatchers say because of the police activity you see there, detours are in place on parts of Stillwater Avenue. People are being asked to completely avoid the area. We will continue to update you as we get more information.
News CENTER Maine learning now that federal immigration agents have arrested another corrections officer from the Cumberland County Jail. We're told on August 22nd, ICE took Nilton Ribeiro, who's from Angola, into custody. DHS tells us Ribeiro first entered the U.S. in 2022 and is permitted to stay through March 7th of 2023. Officials say he will stay in custody while his removal proceedings play out. This is the second Cumberland County corrections officer ICE has arrested this year. Nurses today outside of Senator Susan Collins' office in Portland are protesting donations she receives from Palantir executives.
The AI tech company has been in the spotlight lately for its contracts with Immigration and Customs Enforcement. Christian Harsa joins us now with more on this. Hi, Christian.
Hi, Brian and Amanda. Palantir is a data analytics company that uses artificial intelligence software to process data, and its executives have given Collins and a super PAC supporting her over $100,000 according to campaign finance records. Those donations are what brought Maine nurses to downtown Portland, where they blocked traffic for 10 minutes and pasted letters from children they say are in ICE custody to the front door of the building Collins' office is in. They say Collins should refuse the money Palantir executives have spent supporting her campaign. When asked about it at an event in Millinocket today, Senator Collins said she wasn't aware of the protests or the nurses' complaints.
I have been happy to receive support from donors all over the country as well as the state of Maine.
To donate the money to something that helps. We have a vision for a healthy society, and Palantir does not.
A spokesperson for Collins later claimed that Palantir is helping Mainers save money through its contract with Maine Health to fix insurance issues. For context, though, the roughly $113,000 Palantir executives have donated to Collins' campaign and the Pine Tree Results PAC represents a small fraction of what those entities have received in recent years, some $40 million, and this is just 1/3 of 1% of that. In the studio, Christian Harsa, News CENTER Maine.
Christian, thank you. Meanwhile, Democrat Hannah Pingree, who is running for governor, is sharing her concerns for the health of women and infants as more Maine hospitals close their labor and delivery units. In a statement to the Maine legislature, Pingree says Maine has lost 12 birthing units in the last 10 years. She says this is preventable and requires the state to take action through policy. Pingree's comments come while a group of legislators hold a public meeting in Augusta. Our Drew Peters gives us the details.
Here at the Cross Building, legislators, healthcare providers, and community members are coming together to discuss possible solutions, as well as concerns about what will happen if Maine's maternal centers continue to close.
The birth of your baby or the start of their life is going to be in this place that's sort of dying.
Since the announced closure of Maine Health's Lincoln Labor Delivery Center in Daramuscata, Cecilia Ackerman and Bailey Romaine have been left wondering how their children will be born.
My entire pregnancy, I've been fighting to not let the fear and sadness and anger of this overshadow my happiness.
Concerns they're bringing to a community forum hosted by the State Committee of Health Coverage, Insurance, and Financial Services.
We're all a part of the problem.
Hoping to address the issues that Maine Health and other medical providers say are making it nearly impossible for maternal centers to stay afloat.
It truly was the ability to recruit and retain providers.
Lincoln Hospital Director Cynthia Wade and members of Maine DHHS arguing that Maine's dwindling birth rates, higher number of complex birthing procedures, and lack of financial incentives lead specialty care providers like obstetricians to look elsewhere.
We have to adapt our systems to accommodate the lifestyles of the physicians who are now coming out of school.
State Representative Robert Foley says investing in incentives like loan reimbursements for incoming medical workers and programs that bring maternal health care training closer to rural communities could be a step in the right direction.
To incentivize folks to go there, stay there, and make their homes and their practices in those part of the state.
Fellow Representative Sally Clucci arguing that the state and healthcare providers should be directly funding alternative ways of providing maternal care through telehealth services, midwives, and family physicians.
Different levels of providers, people with different skill sets, all sort of coming together to complement the team.
We should consider labor and delivery services as essential, and they shouldn't be looked upon as something that can be just cut.
The group of legislators say they'll continue discussing on how to implement these potential solutions as the next legislative session in December draws closer. In Augusta, Drew Peters, News Center, Maine.
The University of New England's research pier on the Saco River one step closer now to construction. The Saco River Corridor Commission signing off on extending a permit the college needs to build the pier. It was initially issued in 2024, but concerns about the project and legal challenges have delayed any progress. UNE says the pier will expand opportunities for marine science research and student learning, while opponents worry about the impact on the environment. There are still a few more approvals the project needs before any construction can begin.